Today at Investigate TV Plus Weekend, parents can research a child's doctor, a hospital's reputation, even its ranking. But for many pediatric surgeries, key data about how many are performed is still hard to find.
Seeing your child just in a hospital, for anything, automatically spikes my anxiety. It feels like an out-of-body experience in a lot of ways.
Plus, millions of kids live in counties without a board-certified pediatrician, meaning long drives for families just to get to a doctor who specializes in treating kids.
When you were searching, when you typed in pediatrician, Sparta, Georgia, what came up?
Nothing.
Not one pediatrician?
No.
And what happens when someone who needs medical help calls a rideshare instead of an ambulance? Drivers say it's happening more often, putting themselves and their passengers in a potentially risky position.
I looked back and I had a better look at what was going on, and they were visibly struggling to breathe.
Investigate TV Plus Weekend starts right now. Hello and welcome to Investigate TV Plus Weekend. I'm Lee Zurich. If your child needs surgery, you want to make sure the hospital you choose is experienced. But information on how often many procedures are done on children is often shielded from public view, leaving parents in the dark. Our Joce Sterman discovers why and talks with a nonprofit pushing for more transparency.
Call it the trip of a lifetime, an escape to paradise fulfilling a young woman's wish.
Look how beautiful it is this morning.
On this Hawaiian journey, Juliet Pace could just be a kid, not a care in the world, untethered from life's challenges. But at home in Maryland, reality can be far less fun to capture. It's here Juliet has to face the ever-present threat of a flare-up of the disease she's carried since birth.
Thank you, guys.
And the potential for hospital stays or even surgery down the road.
Seeing your child just in a hospital, for anything, automatically spikes my anxiety. It feels like an out-of-body experience in a lot of ways. Always roll with the punches.
Bethany Pace has felt it many times. Her daughter, now a teenager, has sickle cell disease. The condition hospitalized Juliet 8 times in just her first year of life, and she's been in and out many times since.
I keep a positive mindset by reminding myself, this has happened before, and I have a good hospital 40 minutes away from me, so it can't all be that bad.
Juliet is just a short drive from Johns Hopkins Hospital in Baltimore, which the Paces have trusted with her treatment since the beginning. A big reason, Bethany says, open communication, and not just from the doctors themselves. Hopkins posts data independently on its own website and participates in surveys that detail performance metrics for the public to see. The hospital has also given Bethany the opportunity to serve on a patient and family council that's designed to help improve quality and safety.
What does that say when an institution is transparent?
When there is that transparency, they're saying we are taking accountability for the care that we provide.
But when it comes to care for children, there's something Bethany and moms and dads across the nation will struggle to find even at the most transparent hospitals: data about pediatric surgical volume. That's the measure that counts how often the hospitals that parents trust with their children perform surgeries. It doesn't matter if it's something as simple as ear tubes or as complex as a procedure related to pediatric cancer. Our national investigative team discovered there's virtually no public information available about how frequently certain procedures are done at specific hospitals, even though similar information is widely known about adult patients.
So why aren't pediatric hospitals as open and as transparent?
Josie, let's be clear, they're not even on the same level, they're invisible. There's essentially no volume reporting for pediatric surgery. And for the most part, parents are making blind decisions with their lives of their child.
Their decisions, Dr. Peter Pronovost with University Hospitals in Cleveland says, are being made without critical information because higher surgical volume can be linked to better outcomes. As one of the nation's leading experts in healthcare quality and safety, he says the data parents and patients need to know about volume does exist, but it isn't publicly shared. It could be if the government mandated it.
For pediatric patients, well, they're not included in Medicare data, so they're invisible in that. And every state has an all-payer database that counts surgeries. And the Agency for Healthcare Research and Quality has that data. They purchased it from the states. But the data use agreements between the state and AHRQ precludes them from making this data public, which is just, horrific.
Those agreements governed information collected in something called the Kids Inpatient Database. It's put together by AHRQ, the federal agency Pronovost mentioned. It has information about millions of pediatric patients released from hospitals every year, including procedure data from specific hospitals across the nation. But the fine print we examined shows it's confidential, with use of any information that identifies hospitals strictly prohibited. You can't even contact them to verify their own reporting.
I think it's probably from decades-old agreements when maybe transparency, we weren't as forward and they didn't want to show hospital volumes or the volumes of the individual surgeons. But now we're in a very different place, and transparency is and should be everywhere. And if you have the information that could help parents make informed decisions, my golly, why wouldn't you release it?
We repeatedly contacted AHRQ, asking why it continues to shield this information from public view and how it answers concerns from experts like Pronovost, who say it's time to knock down barriers to transparency in pediatrics. The agency did not respond to those questions. We also repeatedly asked the Children's Hospital Association, which represents more than 200 pediatric hospitals, to talk with us about transparency, but it declined. It would only provide a statement discussing the importance of care, that healthcare decisions should be made between families and their doctors, and that they follow data protection laws that safeguard children's health and privacy.
This is an area where the quality movement has left children behind, and it needs to go back and remedy that.
An organization called Leapfrog is trying to help parents see behind the curtain of children's hospitals. The nonprofit collects voluntary surveys from facilities coast to coast, gathering data on safety and quality. We found that most general hospitals cooperate, with about 2/3 of the more than 3,000 surveyed submitting information to Leapfrog. Pediatric hospitals, on the other hand, have been far less responsive.
As a parent, I will go to the end of the earth to find the right hospital for a child who needs critical care. And yet, very little is available to me to choose among those hospitals.
Leah Binder is the CEO of Leapfrog, which publicly publishes those surveys from hospitals across the country. In them, the organization asks pediatric hospitals for some specific data, like how many infant heart procedures they perform, their infection rates, and whether they have doctors specially trained to treat kids. We analyzed their surveys dating back to 2023, discovering that more than 2/3 of the 90-some pediatric facilities they surveyed declined to respond. That includes some of the biggest names in pediatric medicine: St. Jude's, Children's Hospital of Philadelphia, and Children's National in D.C.
The impact is that many parents are entrusting the lives of their children to hospitals that they don't know how they're doing. And that's very unfortunate.
Our team canvassed dozens of children's hospitals from coast to coast, asking questions about why they didn't participate in the Leapfrog survey and where they post data to help parents who want to know critical information. We repeatedly heard that while transparency is a priority, limited resources make responding to Leapfrog challenging, diverting significant time away from patient care. Many facilities told us they voluntarily report data to registries that track specific conditions or surgeries and supply information to state agencies or medical associations. Some told us they have questions about Leapfrog's methodology and prefer to participate in the survey from U.S. News and World Report, a media company which ranks hospitals but doesn't publicly post specific data or statistics. As a result, there's little uniformity or mandated pediatric reporting, leaving a patchwork of information for parents and patients to wade through.
And I would just wish that everybody could everybody's equal and that we can all get the same information.
That's something Juliet's mom, Bethany, could help with, thanks to her role on that patient and family council.
I'm part of this because it is open for talking about the good, talking about the bad, talking about how we can continue to get better as a hospital.
She says if those councils at hospitals across the country band together, they could have real power, something Pronovost agrees with. Together, they could make a unified push for mandated pediatric data reporting in places parents can see, so they can make informed decisions about what they value most, their children.
All of us have something that is part of our life. You know, we all figure out how to navigate it, and it's with care, and with data, and information, and resources that really go to how well we do that. And so that is absolutely what I'm focused on for Juliet in creating the life that she's meant to have.
Experts say parents should ask surgeons and hospitals directly how often they've done pediatric surgeries to make sure they feel comfortable. And when it comes to making data about children more widely available, we're told it likely won't happen unless Congress and consumers demand it.
General practitioners, they're okay for general things. But if you have kids, you want somebody who can see about a kid.
Coming up, we investigate why access to pediatric care is shrinking in parts of the country, and what happens when the only children's doctor is miles away. One pediatrician, 4,000 children. Some families drive nearly an hour just to see her. This is a reality for many families across our country that right now is experiencing a pediatric care crisis. Our Andy Perotti discovered there are hundreds of counties with no board-certified doctors for kids, and it's getting worse.
There's a church right down here we're going to pass.
Markeisha Hawkins takes us on a drive she knows like the back of her hand,
I know everybody over here.
pointing out every church, farm, and home along the way.
It's going to be on your right-hand side.
A 30-minute route out of town she's taken hundreds of times to care for her children. Her sons, Ethan and Logan, were both born prematurely. Her firstborn weighed just 2 pounds.
It was scary because I got this preemie. And for one, it's not the regular preemie. They're called micro preemies because anything can go wrong at any moment with those kids.
Logan spent weeks in the hospital and suffered serious lung complications. Markeisha knew she needed a pediatrician to care for them long term. They live in Sparta, Georgia, about 2 hours south of Atlanta. When you were searching, when you typed in pediatrician, Sparta, Georgia, what came up?
Nothing.
Not one pediatrician?
No.
Nationally, 43% of counties lack access to a children's doctor, according to data we analyzed from the American Board of Pediatrics. That's nearly 4 million children who live in counties without a single board-certified pediatrician.
Hello, how are we?
Back in Georgia, Dr. Christy Mountain Bonner is the Hawkins family pediatrician who practices in neighboring Washington County. She's the only pediatrician in private practice there, caring for about 4,000 children.
We'll be.
Some families drive nearly an hour to see her.
It scares me because in those other counties, I know there are premature births and premature babies that are needing the care. And sometimes I find in rural communities, there are issues with transportation. There are issues with finances to fund transportation.
A study published by the American Academy of Pediatrics in December reveals a compounding problem. More hospitals are dropping pediatric services altogether, disproportionately affecting rural areas. Dr. Kenneth Michelson authored the study.
What we found was that hospitals have become less capable at taking care of kids over time. More than half of rural units actually closed over a 15-year period, which is just amazing and huge.
And in your opinion, what's the impact on children's health in those communities?
First is that if you're in a community, most likely pediatric hospital care is getting farther away from you. So if your child is really sick and needs to be hospitalized, you are likely to need to travel farther for that. I think the second clear impact is that it makes the overall system more brittle.
I'm gonna listen to your heart. General practitioners, they're okay for general things. But if you have kids, you want somebody who can see about a kid.
Right.
They're different. Their bodies are different.
If you retire today and no one replaced you, what would be the impact to this community?
I think it would be great in terms of, because I think you would have a situation where patients are scrambling to find someone to see their child quickly. And I think the scramble would be too large for the other practice to take on.
No pediatricians, no doctor, no urgent care.
After a long road to recovery, Markeisha's sons are now healthy and thriving, and she credits their pediatrician, who was there every step of the way. If you didn't have Dr. Mountain, where do you think your kids would be as far as...
I cannot imagine without Dr. Mountain.
Long sound clear.
Don't even make me think about it. I can't.
I had a woman who had fallen in her house and her son had to help lift her into my car and I had to bring her to the hospital.
Up next, we look into the growing concern over people using ride shares for medical transport and why drivers say they're not prepared for what can happen next. You can watch Investigate TV Plus anytime online. Just subscribe to our YouTube channel at Investigate TV. You can catch stories and full episodes. As ride shares become a routine part of daily life, some drivers say the job can take an unexpected and dangerous turn. In some cases, they tell us they're being used to transport people with serious medical needs without the training or equipment to do it safely. Reporter Marius Payton in Nashville investigates why some rides are starting to look more like emergency transport.
It was something this rideshare driver never expected.
I looked back and I had a better look at what was going on, and they were visibly struggling to breathe.
Neither did this driver.
I had a woman who had fallen in her house and her son had to help lift her into my car and I had to bring her to the hospital.
Both drivers wanted to hide their identities, fearing repercussions from their companies. But they both tell the story of a growing problem. People using ride shares as a substitute for an ambulance. In many cases because it's less expensive, situations these drivers admit they are not trained to handle.
I got them to the ER and I ran out and called the nurse, and they came out with a wheelchair and got them out.
I don't know how to make sure that my passenger who came into my car, that her leg would be positioned correctly to as not further injured after she had her fall. I don't know how to get her out safely either. We don't have any gurney to set her leg.
Why would someone call an Uber rather than an ambulance? That's the bigger question, That's the bigger failure, in my opinion.
And it's not just Nashville. A 2019 study by the National Emergency Medical Services Information System, or NEMSIS, found that there was a 7% decrease in ambulance volume in cities that have Uber.
So the interesting thing is that there really is no alternative for patients to get from one facility to another that isn't an ambulance. They have to drive themselves or find somebody else to drive.
Patricia Kelmar is a senior director of healthcare campaigns for the Public Interest Research Group, a consumer advocacy organization. She has seen the struggles and the debt patients can get into when insurance companies decide what qualifies as emergency transportation and what doesn't. It often leaves patients with a tough decision.
I might be on some medications that make me dizzy, so I should have a professional drive me to the new location. I don't want to pay a $6,000 ambulance ride for that transportation, but I do want to get to the other facility safely.
The drivers I spoke with believe a solution could start with rideshare companies. Take a look at this ride receipt. Right beside the rate and the mileage is the word teens. That lets the driver know who they will be transporting. There's also one for pets. So they want to know why there can't be a descriptor that simply says medical. They say it would provide a level of transparency that would allow them to accept or reject rides, but that's just one possible solution. The question still remains what to do about people using Ubers as ambulances.
And I feel like we're in the last 5 or more years where people are realizing like, oh, if I need something even as desperate as medical attention, like I can use this service.
Uber says its Uber Health service is designed to help healthcare organizations arrange non-urgent medical rides, but NPR reports drivers are not told when a passenger is using Uber Health, and that's by design. It's to help protect patient privacy and meet HIPAA privacy standards. We reached out to Uber about this story and have not heard back. After the break, we share a simple travel timing trick that could help you save money, skip some of the crowds, and still get the vacation you want. The best vacation deals don't always come in the busiest seasons. Travel experts say if you're looking to get more trip for your money, timing can make a difference. Our Rachel DePompa shows how shoulder season can offer lower prices, fewer crowds, and a smarter way to plan a getaway in this week's Watching Your Wallet.
Shoulder season is a secret weapon for any savvy traveler. If you've never heard of it before, shoulder season falls between peak and off season. NerdWallet travel expert Sally French says it's the sweet spot for affordable travel.
We all know peak season tends to be holidays, summer breaks, and then off season is a time when you might not want to travel because the weather's really bad. Often places are closed, but shoulder season is that sweet spot. Typically, it's that period right before spring break or summer break, or that period right after.
That time in the fall when the kids go back to school, she says you tend to get the best of all worlds, lower prices, less crowds, and good weather.
The best time to book a domestic trip is 1 to 3 months in advance, 2 to 8 months in advance for an international trip. So if you want to get ahead of those spring break or summer crowds, definitely think about a lot of those shoulder season itineraries are bookable now.
French recommends picking a few destinations and then typing in the search bar, when is shoulder season for that location, to start your search for deals. She also says use something like Google Flights to search for the cheapest flight in the calendar view. That way you can scroll week to week and see when flight prices drop for a specific location.
And that's it for us. Thanks for joining us here on Investigate TV Plus Weekend.